Welcome to the Well-Connected Communities Master Volunteer Program training module on understanding data and how to use it. This module features a January 2018 recording from the University of Wisconsin's County Health Rankings and Roadmaps team discussing their data products and how to use them to understand the health of your state and community. County Health Rankings and Roadmaps is an important part of the Well-Connected Communities initiative as it incorporates public data in a consistent, easy-to-access format for nearly every county in America.
The County Health Rankings and Roadmaps program is based at the University of Wisconsin Population Health Institute, and we are a collaboration with the Robert Wood Johnson Foundation. We'd also like to acknowledge that this program is the result of the contributions of many colleagues and partners in Wisconsin and across the nation. And thanks to their support, we're able to bring you this webinar today. I'm joined today by a small team of colleagues, and together we'll be talking today about how the County Health Rankings and Roadmaps works to improve health outcomes for all. So let me welcome Amanda Jovag, our Rankings Team Director.
Hi.
And Jessica Rubenstein, an evidence analyst with What Works for Health.
Hello.
And Karen Odegaard, a community coach with the Action Center.
Hey everyone, thanks Kate.
So first, we want you to understand who we are, what we do, and why we do it. And we want you to be prepared to use data, evidence, guidance, and stories to support your work. So let's start with the why. So why does County Health Rankings and Roadmaps exist? Why do we produce the tools and resources that we do to support communities? To start, County Health Rankings and Roadmaps has two primary overarching goals. The first is to improve health outcomes for all, and this includes both how long people live and how healthy they are. Our second goal is to close the health gaps between those with the most and least opportunities for good health. We believe that everyone should have a fair opportunity to be as healthy as possible, regardless of where we live or the circumstances we're born into. And the choices that we make depend on the opportunities that we have. Things like access to healthy foods or a quality education or living in safe and affordable housing and crime-free neighborhoods. Not everyone has these opportunities. These unequal opportunities create differences in health, and they don't come about on their own or because of the actions of individuals alone. They are often the result of policies and practices at every level that have created deep-rooted barriers to good health for some people. We see this in things like bank lending practices, school funding based largely on local property taxes, and policing and prison sentencing that have perpetuated discrimination. That means that everyone does not have a fair and just opportunity to live a long and healthy life. But communities have the power to change this. So think about your own community. Who isn't thriving? Who doesn't have the same opportunities for health? What are the barriers that have been put in place over the years? And what will it take to remove those barriers and change the opportunities in your community? So we talked about the why. Now we'll take a look at the what and the how. As I mentioned, one of our goals is to improve health outcomes, and we'll look at that more closely. We use two key images to think about the what and how of creating healthy communities. The image you see here is our rankings model, and this helps us understand what drives health in a community. One of the goals we've had with this image is to help change the conversation about health and what influences health. What this image shows us is that health is more than what happens at the doctor's office. There's a wide range of factors that influence how long and how well we live. And that includes things that we often think about when we hear the word health, so things like healthcare and how well we eat and how much we move. But we know it's also things like education and income, the quality of our housing, and the safety of our neighborhoods. And now I want to share the take action cycle. This is the how of creating a healthy community. We believe community transformation begins with the steps in the take action cycle, starting with assessing needs and resources and moving through to evaluation. Communicate and work together wrap around the cycle because these activities are essential throughout, no matter what step you are in. And at the heart of the take action cycle is people working together. We know that when people work together with a shared vision and commitment to improving health, it can yield better results than working alone. So while these images may look pretty simple, we know that putting these ideas into practice is challenging, and we've developed various tools and resources to help you do that. And we're going to take a look at those tools and resources in just a moment. At County Health Rankings and Roadmaps, we work to support communities to bring people together to look at the many factors that influence health, select strategies that can improve health for all and close gaps, and make changes that will have a lasting impact. And we do this by providing data, evidence, and guidance for communities. We also work to gather and share stories of communities around the country that are at different points on this journey to serve as both examples and inspiration for you and your partners. We are going to go deeper into each of these areas, data, evidence, and guidance. So finally, finishing up our introduction here before we jump into our deeper dive into the resource areas, I want to show you quickly where you'll find these different tools and resources on the website. So Amanda's going to go briefly to the website when she discusses the data resources, but we aren't going to do a full website tour today. But I do want to show you a few basics to point you in the right direction. So our data resources you'll find primarily under the Explore Health Rankings tab, that first tab in the orange bar. The evidence and guidance tools and resources that Jessica and Karen will discuss, so that's What Works for Health, the Action Center, and the Partner Center, are in the Take Action to Improve Health tab. You'll find stories as well as links to upcoming and past webinars, including that website tour if you think that might be helpful to you. And those are in the Learn from Others tab. And if you need some additional background in understanding our thinking about health, what influences health, you'll find that under the What is Health tab. All right, so now we're going to explore each of these areas in a bit more detail with Amanda from our rankings team, Jessica from our What Works for Health team, and Karen from our community transformation team. For each of these areas, we'll get a sense of why it's important, what we have available to help support your work in your community, and how to make the most of these resources. So we are going to start with data. In our communities that we work with, we get lots of questions about data. Why is data such an important? So, Amanda, why is data such an important resource for communities?
Hi, Kate. Thanks for asking that. So data is a resource that can be used all throughout community health improvement processes. First, it can be used to assess the health of communities. Communities across the country are incorporating County Health Rankings data into community health needs assessments, as well as using it for other health improvement strategies. So data can be a tool for engaging communities in health improvement. The rankings prompted a sense of urgency for the United Way of Greater Toledo, along with the community it represents. The County Health Rankings model became a tool to talk about the social determinants of health and how to respond to them. Data can help us identify root causes of health issues. The Menominee Nation of Wisconsin, which was a 2015 Culture of Health Prize-winning community, used the Adverse Childhood Experiences Scale as a screening tool to measure the community's children's exposures to traumatic experiences. When they found that many members with scores indicating a high risk of health problems, the tribe decided to take a trauma-informed approach to health that focused heavily on consistently evaluating the mental and emotional well-being of residents and providing the supports that they needed to move toward healing. So it can also help support decision-making and policy changes. Communities around the country are using data to convince policymakers to enact the programs and policies that will create the environment for a healthier community. And it can be used to track progress. As communities take action, they've used data from the rankings and from other sources to understand whether policies, programs, or plans are on track to improve health.
Great, thank you. And I've certainly seen communities using data for all of these reasons. So how do the County Health Rankings help communities use data?
Well, how about if we take a look at our website and I can show you a quick tour of the many resources we'll offer. It'll just take me a moment to share my screen. Okay. So hopefully everyone now can see the County Health Rankings website. Maybe, yep, you can. Wonderful. Okay.
All right, so where should a community interested in the rankings start?
Well, as you mentioned, most of our rankings resources are included in the Explore Health Rankings portion. So I'll click on there. It has all the resources gathered in one place. For the first time, we have a rankings landing page here. So this is where you can get all of our annual reports. You can get guidance on how to use the data, information, I'm just going to scroll a little bit down, on our background and our methods. You can access a primer on understanding why ranks change and what that means for measuring progress in communities and how else to go about measuring progress in communities. You can also access the rankings for your state. So Kate, I'll let you make the call. What state should we look at first?
All right, how about my home state of Pennsylvania?
All right, so let's do a little search for Pennsylvania. Okay. So when you search for Pennsylvania, you'll get to the state landing page. Every state has one. Here you'll start and see first 2 maps that give you kind of overviews of the health rankings in this state. We can see that more deeply shaded counties are the worst ranked counties in the state, and the more lightly shaded counties are the healthier counties in the state. Okay, and if you scroll on down, you can find your state health gaps reports. You can find stories from your state, and we also have a contact within each state who is familiar with the rankings and is able to connect you with resources you might need.
Wow, there's a lot of information on that one page. So what are the state data resources and community health improvement resources that I see here?
Yep. Okay, so we know that the rankings data is just a starting point for understanding health in your communities. And we want to give some help to get people to the information that they need. In order to do that, our team finds state-specific data resources that can help users dig deeper into topics that they might need. So let's take a look here. In Pennsylvania, we have information on the cancer registry, so you can find information on cancer incidents. We have links to their Department of Education data and statistics if what you find is that you need more information about schools and any sort of educational outcome. We have information from departments of health and environmental health and crime information. We also have some links to kind of important partners that you might want to consider contacting if you're going to undertake a community health improvement process in your community. So that's what we have in for those resources. Okay, I'm going to go on back here. So Kate, what county would you like us to take a look at?
All right, we're going to go with hometown. I grew up in Harrisburg, and that is in Dauphin County.
Okay, so let's find Dauphin County. I'm always worried I'm going to spell these counties wrong, so I like to use the list here instead of if I'm not familiar with the exact spelling of the county. But you can also search for the county there in that spot. Okay, so Dauphin County, let's take a look here. We see that Dauphin County has, if we're going to start in the beginning, we might want to get a big picture. The best way to get that really big picture look, I think, is probably the ranks for Dauphin County. We can see that Dauphin ranks 39th out of 67 for health outcomes and 28th out of 67 for health factors. So we're looking at a county that is kind of in the middle of the state for health. Not the best, not the worst. Probably has some areas where it's doing really well and some areas where it's kind of struggling. So there's the next thing I might do just to get a little idea about where they might have those strong points and those weak points is look at the ranks for the different health factors. So each of our health factors, we have health behaviors and clinical care. I'm not going to scroll too fast. I know it makes people sick. So let's look at the ranks there. We have a rank of 44 for health behaviors, clinical care a little better at 13. And then we go down to social and economic factors with a rank of 24, and the physical environment with 29. So like I was saying, they have some strong areas. Clinical care is looking like it is pretty good in Dauphin County, and they have some areas that they can work on. The physical environment is a relatively low ranking, and health behaviors is a relatively low ranking place. So that's kind of gives you a perspective, just a very big perspective of what might be going on in Dauphin County. The next thing I like to do is think about not just what's happening now, but what's been happening over time. I always open up the trend graph for premature death. When I look at a county snapshot, so I'll open that up right now. We really want to understand if we need a big picture understanding of where we've been over the past, say, decade, understanding this important health outcome is great. So we include trend graphs for about 13 of our measures. We try to include them for every measure that has at least 5 non-overlapping measurements that we can detect a trend from. So Dauphin County has been getting better for premature death. It's kind of been right at both the state and national average. It is a very average county for health. So that's, that's pretty good. They have been improving over time and have really been very consistent in their improvement, but it hasn't, really deviated from state or national trends. Okay, so I'll close that up. So there's a lot of measures on this page, and sometimes it can be really hard to figure out what on earth would I look at. I know we had some, Dauphin County had some problems with health behaviors and looked pretty strong in clinical care, but where should I look next? I understand it can be a little bit overwhelming. So helping a community define their focus area really is a multi-step process that has to look at both what the problems are and what solutions might be available in that community. But we have provided 2 tools that can give a head start. I'm just going to scroll up really quick. We have areas to explore and areas of strength. So when you click on areas of explore, it'll highlight measures that are particularly worrisome when compared to the state or national averages. When you click on areas of strength, it will highlight measures that are looking pretty good when you compare it to state or national averages. Okay, so these comparisons are not intended in any way to replace a real priority setting process, but they can give you a quick peek at kind of the strong and weak areas in your county. I'm going to scroll down pretty slowly here, and like we might expect, health behaviors show a few areas to explore. That was, one of the lower ranked areas of health factors. Clinical care has some real areas of strength, again, like we might expect. A few more areas to explore in the social and economic factors, which make up a big portion of our rankings, and a few more in the physical environment.
Thanks, Amanda. That was a really helpful tour of the snapshot. So it looks like Dauphin County has a number of areas to explore, and as someone who has spent some time there, this doesn't surprise me. But I'm particularly concerned about the high rate of children in poverty there, especially as you mentioned that social and economic factors play such a big role in health. So what else can I learn about that measure?
Sure. So that is a really important measure to take a look at. You can click on any of our measures and get a lot more information if you want to find out more about that measure. So first you end up with a map that will highlight the counties that have the highest values for children in poverty are the most deeply shaded counties, and the values that have the best are the lighter shaded values for the county. You can also go next to a data table that shows you all the values for children in poverty. For all the counties, you can sort by the rates of children in poverty, or by the counties themselves. And you can see here a new feature that we added in 2017. For a few of our measures, we are now able to offer data breakdowns by race and ethnic, just a limited number of racial and ethnic categories within counties. Keep an eye out for these because we're hoping to add more soon. After this data table, you can go to the description where you can find out each measure's background, why we rank on it, some technical strengths and limitations, and you can look into the data source if you're like, I want to find out where you got this from. Maybe they have other data that I'm interested in. You can go here, learn something about the data source, click to download the data itself or find more about the methodology that it uses. And then we encourage users to explore the list of policies and programs. I'm going to click on this that one might undertake to work on improving this measure or measures like it. This data comes from What Works for Health, which you'll be hearing more about soon. But it kind of just is a tie to action. Yes, we are concerned about the data, but we're concerned about it so that we can take actions to improve health. So definitely don't miss this list.
That's a great tip. And Amanda, you mentioned a new feature that was added in 2017. Were there any other rankings related features added to the website recently?
Sure, yes, we actually added 2 more really neat features. So I showed you this description all about measures, but I will note these are pretty technical. They are meant to be helpful, and we really hope they are, but they're also supposed to really help people who want to maybe replicate this measure or understand really our scientific underpinning. We have added a new feature in Learn More About This measure that's intended to really speak to, okay, you're a community who wants to use this measure. You might want to use it for tracking over time. You might want to use it for targeting. Well, what do you need to know in that instance? How can we help you break this measure down as simply as we can, or kind of give you some heads up about things that might matter as you're trying to use this data in your community? Some things are as basic as saying, like, this is a percentage. Sometimes it's a rate. Sometimes it's a ratio. We know when measures are modeled versus measures that don't use any statistical modeling in their creation, whether they can be used to track progress, and what are some other sources that you might want to go to that could give you more information about this measure. That's a great feature. I hope you check it out. In addition to that, this year, I'm just going to go to a snapshot again. We'll go back to, I'll just go to a different county here, one of these top ones. Premature death is such an important measure, and sometimes people are really wondering, well, what are causing all these premature deaths? And if you click on the I next to premature death, we now list the 5 leading causes of death that led to the deaths that we are calculating premature deaths from. So in Bedford County, people are dying from cancer, heart disease, accidents, cerebrovascular diseases or strokes, and chronic lower respiratory diseases. These are available for every county that we have premature death data for. So I go and take a look. So I thank you for joining me on this quick tour. There's a lot of resources here, and I hope you'll spend some time there on your own. I'm going to stop sharing my screen now. Just our key takeaways is that rankings are a great starting point to draw attention to problems that matter in your community, but don't stop at the data. These data are meant to be used to drive action in your communities. On that note, I'd love to turn the presentation towards the What Works for Health program that provides the evidence needed to implement the best programs and policies in your community. Thank you, everyone.
And thank you, Amanda, for the overview of our data resources. So once a community understands its challenges and strengths and has figured out kind of where they want to put their energy, and they need to know what they can do. So what strategies should they implement? One factor in deciding what to do is understanding the evidence of how effective a strategy has been at changing outcomes. So we're going to turn to Jessica now, one of our evidence analysts, to walk us through our evidence resource, What Works for Health. So before we jump into What Works for Health, let's start with a basic but really important question. What is evidence?
Hi, Kate. We hear this word evidence a lot. Evidence-informed, evidence-based terms like proven, model, and promising. This word has different meanings to different people and different organizations who work in this space with us. So before we dive into what evidence means for us, I'd actually like to take a minute to ask you to think about what evidence means to you.
Yeah, so as a program, we really believe that evidence matters. Can you tell us a little bit more about that?
Evidence can help us drive smart investments and stretch the impact of scarce dollars. It helps to inform decisions about when to adopt the sort of tried and true strategy options and when you might want to be more innovative, and also to inform innovation. Knowing what has been shown to work and what hasn't can help to ensure that innovative solutions are effective.
Okay, so I've mentioned What Works for Health a few times, so let's finally get into what is What Works for Health.
At its core, What Works for Health is a tool to help communities make decisions about the strategies they can use to address local health priorities, and to do so without having to reinvent the wheel every time. It really makes harnessing evidence easier for communities.
And what does this tool have for communities looking for evidence to inform their work?
We provide a menu of ideas summarizing the available evidence and providing examples of where strategies have been implemented. And by strategies, I mean policies, programs, systems, and environmental changes. We're a living resource. We're constantly updating our current strategies and adding new content, which means today we actually have nearly 400 strategies available.
That's pretty impressive. So what do each of those strategies include? What will people find when they click into one?
So for each strategy on the menu, we include an evidence rating, and this conveys the likelihood a strategy is going to work based on the best available evidence. It's really the core of what we do and how we think this resource can be the most useful for you. It indicates which strategies have been shown to work, those that might work, and then those that have been shown not to work or to cause harm. We also have short literature summaries that highlights who a strategy can benefit, what it can do, and as we have it, information about the costs. We also include disparity ratings to help communities use an equity lens as they explore our strategies, and implementation resources to move from idea into action. So this is a slightly shortened version of our mixed-use development strategy summary. We're not going to walk through all of the details today in the same way that Amanda did. We just want to use this to give you a quick glimpse of what all of those elements look like when they come together to form a strategy.
All right, thanks, Jessica. So that's a lot of really rich and valuable information. So how can communities make the most of it?
Well, we like to suggest an approach that we think of as evidence plus. It connects the evidence you find in each strategy with your local culture and context. So as you explore what works for health and read through specific strategies, you'll find content to support this approach.
And how do you do that?
You start by asking questions like, does this strategy work? Will it work here? And then you look at the details. Our evidence ratings show the likelihood a strategy will work based on the best available evidence. And there's also a field called the expected beneficial outcomes, and that'll show you what a strategy is actually rated for. And then you want to confirm that these outcomes matter to you. Reading the evidence of effectiveness summary can help you know if a strategy is likely to work locally. Do you see populations like yours, communities like yours? The disparity ratings indicate likely effects on disparities or gaps in expected outcomes. And the implementation examples we have include toolkits, model policy language, and illustrations of how communities put a strategy into action.
Thanks, Jessica. And that's kind of a great segue into, we talked about stories being one of our resources, understanding what other communities are doing. Amanda shared a few in her data overview. And now we'll take a quick look at how communities are using What Works for Health in different ways. So 2 quick examples from communities that we've worked with, that our community coaches have worked with. In Sitka, Alaska, their team used What Works for Health at their annual health summit to help inform goal selection and come to consensus. Because it's an accessible and easy to use resource, it can be great to use with larger community groups to inform the group discussion around strategy selection. Another example comes from the Health Foundation of LaPorte, Indiana, and they use this in their grant making process so that local organizations could search for program and policy examples as they worked on their grant funding, obtaining grant funding. We know that lots of funders want to see communities using evidence to inform their work, and this can take a lot of the legwork out of that process for you.
What we'd really like you to take out of what works for health, just out of this quick summary, is that evidence is a really important part of decision making, but it's not the only part. What works for health provides information about what works, what might work, and what doesn't work, and you should connect the evidence available with your local culture and context to maximize the effectiveness for you.
Great, thank you so much, Jessica. Okay, so we talked about data and understanding community needs and assets, and we talked about using evidence to understand what communities can do to change outcomes. Where does guidance fit into this picture, Karen?
Yeah, so we know that the work of transforming communities is not easy. But we believe that by supporting communities with guidance about how to take action and who to work with, that we can accelerate their progress toward improving health outcomes and health equity. So Kate showed the take action cycle a few slides back, and I want to go back there for just a moment because this image illustrates how communities transform health, and at its center, who has a role to play in making it happen. Our Action Center and Partner Center are both grounded in this take action cycle. So you may recognize it as a basic community change theory. The guidance that we provide helps communities work through each of these important steps in community change and to consider the different types of people to work with along the way. When we asked a little earlier about the opportunities that you see in your communities, we saw lots of responses about forming new partnerships and building relationships, about conducting community health assessments to really understand what needs you want to address. The guidance that we provide in the Action Center and the Partner Center really support those kinds of efforts in communities. So if we look at the cycle, we know that that action in communities isn't always linear. Sometimes you're going to see these steps overlapping, and you may find yourself moving back and forth, and that's perfectly okay. But we believe that it's important to understand not just your community's needs, but also its resources, to select priorities, because if everything is important, then nothing is. To look at the evidence when considering what to do, but as Jessica just told us, it's also important to consider things like local context and priorities when you're selecting policies and programs that will work for you. And all of that work gains meaning when we actually take action on what is important, and when we learn whether that action is doing what we set out to do.
All right, so let's talk through some of the ways that we provide guidance for these different areas and steps.
Yeah, so we provide guidance in a few key ways. For example, learning opportunities like this webinar today and other webinars, as well as more interactive discussion groups that we host, our online Action Center and Partner Center, and then coaching support. So today I'm really going to be focusing on our online Action and Partner Centers and the coaching support that we provide. So if we start with the Action Center, you will find this, as Kate mentioned earlier, you'll find the Action Center under Take Action to Improve Health on our website. And the Action Center provides step-by-step guidance and tools to help you move with data to action. The Action Center answers the question, how can we take action? Each of the action steps that you see on the screen and that are in the Take Action cycle are broken down into key activities with guidance and suggested tools to support your work.
All right, so we know that this is another deep and rich tool. How can people get the most out of the Action Center?
Yeah, I really like to think of the Action Center as a destination. So once you get there, you start by taking a look at the steps that we've laid out that are really going to help you move your community forward. And ask yourself, where do you see your efforts? So for example, maybe you're assessing your needs and resources or trying to choose effective policies or programs. those guides may be your most useful place to start. You might also think about where you're feeling a little stuck. Maybe you're having trouble moving from assessing and planning to actually implementing the policy changes or the programs you've selected. Well, then act on what's important could be helpful. Or maybe, like so many of us, you struggle to keep your partners engaged or to recruit diverse stakeholders to your efforts. Then our Work Together guide can help. So you can find the guide that seems like the best fit for you in the moment, click into that guide, review the related key activities, and choose one that resonates with you. The most important thing to remember is that although this is a destination page, it is also meant to be a just-in-time resource. So we don't expect you to read and absorb it all in one place or at one time. But come back, revisit the page often to find the right resources when you need them. So I actually like to suggest that people set the Action Center as a favorite in your browser so that you can get back to us often to find what you need.
Thanks, Karen. And just to share a quick example from one of the teams that we coached that used some tools and guidance from the Assess Needs and Resources Guide. So in Escoda County, Michigan, the coalition was well aware of their challenges. Lots of communities do their community health needs assessment, but they needed to understand their assets. So working with their coach, they turned to the asset-based community development tool. It's in the Action Center in the Assess Needs and Resources Guide. And they use that to help frame their process for understanding individual and community assets that they could build on. And that process really helped them to build momentum for community events, kind of change their mindset about that they did really have strengths and assets in their community that they could build on. And it really opened doors for additional collaboration.
So if we move over and talk a little bit about the Partner Center, we all have a role to play in creating healthier communities. And by working together, we can achieve more than working alone. The Partner Center, which again you'll find under Take Action to Improve Health on our website, is all about joining with others to make lasting change in your community. It answers the question, who should we work with? So think about the people in your community who make positive changes happen. We can call them leaders, change makers, or stakeholders. Whatever you call them, these are the people that you want to be partnering with. But how do you reach them? Well, you can start by doing some research to find out what their goals are and how they might align with yours. You can think about what's in it for them, and then find a way to get connected so that you can begin to cultivate a relationship. The Partner Center can help get you started. It provides guidance around why different sectors might care about creating a healthy community, what they can do, and how you can engage them.
All right, so again, another deep tool. How can people get the most out of the Partner Center?
Well, many of us play different roles in our communities. We may work in healthcare, but also serve on a government board. We may work for a nonprofit that also serves as a funder. So you can start with the roles that you play in your community or explore the different sectors that you want to be partnering with. And if you don't see yourself in any of the sectors listed here, remember, we are all community members, so you can start there. So the last thing I wanted to just note is about our community coaches. So this is just one more way that we provide guidance. We have a team of coaches who help to strengthen communities through tailored guidance, questions, and support. So if you need a thought partner to help you get unstuck, or you want some help thinking about how to use any of the resources that we've talked about today, please reach out to us via the Contact Us form. You will find that Contact Us form at the bottom of our website throughout the site. So once we hear from you, we'll definitely be back in touch with you to learn more about your community and your specific needs. And finally, just to wrap up with a couple key takeaways about the guidance that we provide. Remember that the Action Center answers the question, how can we take action? And the Partner Center helps answer the question, who should we work with? Our coaches can help you connect with any of the resources that we talked about today.
Question is how to explain health outcomes to community members that want to know why the rankings change and what can be done to help. And I know some of this is messaging, but maybe Amanda could give some insight on perhaps why rankings change and what it may or may not necessarily mean.
Sure. That is a question we get a lot. People are always asking, well, why did our ranks change? And the first thing that I always go to when asking that, or when answering that question, is the graph that I pointed out on the website. I always look at the premature death graph. Sometimes it makes it clear that, you know, even though you've been improving, the state has been improving even faster. Or this year was a particularly good or bad year for premature death. So it's always that graph answers that question a lot, but it doesn't answer the question of, you know, what can we do about it? How can we change that? And that really goes more to the health factors that you need to take a look at. And I think, again, you know, taking a look at areas to explore will give you a hint, but you also live in your communities, and asking your own community members, what seems to be holding us back from being the healthiest community we can be? Is probably also a good question to ask. So that's a brief way that I'd talk to community members about that.
Great, thanks, Amanda. On a related question, I think that came in during the webinar, seeing that someone noted that some of the data came from 2014, or seeing that there may be some lag in time on some of the measures. How would you respond to that, and what other options are there if they're looking for maybe more updated measures?
Sure, that's a great question. We get so many questions about what year of data this measure is from, or where does our data come from. So our data comes from about 30 different sources. We use a ton of sources in order to create the county health rankings. We're gathering data from education data and census data and health data from the CDC, just to name a few. And so those data sets are often updated at really different times. So we always try to gather the most recent data that's available when we are releasing the most recent county level data that's available when we're releasing. And each year we provide a new update to that data. So unfortunately, yes, some of our data is not as recent as we would like. It takes these federal agencies often some time to process the data and then get the county level indicators out. But we are always working to provide the most recent data available. And I stress people really need to look at each measure, because each measure comes from different years. The 2017 county health rankings did not contain data from 2017, which is actually a question that I get fairly often. So make sure you take a look at what years each measure comes from. There you go.
Great, Amanda. And you know, since we're talking about data, and since you're just on fire here, I have one more question. How can someone look at, you know, they called it more kind of quote street level data, sub-county level, if you will. What are some options if they're looking for that?
Sure. So this question, I think there's kind of two answers for it. In those learn more links that I showed at the top of each measure page, which are really meant to help communities, we tried to provide them with any national resources that we knew provided sub-county data. So if there's anything that they can get to, you know, school districts or census tracts or zip codes or anything smaller than counties at all, we tried to provide links to those in the Learn More pages. In addition to that, those state resources that I tried to link to can be a great source of sub-county data. Now, not all of them have it, but that is definitely something we were looking for. If it did have sub-county data, we were much more likely to include it in those lists. So that is a great place to start if you're looking for sub-county data.
I'm going to shift over to a kind of evidence related question, getting a little more into the nitty gritty about how we define strategies that work and kind of the system to do that.
If you go to What Works for Health, our landing page under Take Action to Improve Health, if you scroll down, you see where you can find our strategies by topic or keyword. And if you scroll down a little bit further, we have some other areas to let you get a little bit more in-depth and background on how we do our work, information on our ratings, but then our methods is actually where you're going to want to look if you want really specific information. We have basic standards that each rating has. So if we could click on Learn More right here, and if you scroll down through here, you'll see the very explicit guidelines. What it comes down to is the more high quality evidence that's available, the more likely a strategy is to be rated scientifically supported if it has strong positive outcomes, all the way down into our evidence of ineffectiveness, where we also need strong quality evidence to determine that there does not appear to have a strategy doesn't have an impact or might even cause harm.
Great, thanks. I think that's really helpful.
For those of you that are newer to us, you can follow us on Facebook, on Twitter. You can sign up for our e-newsletter to get information about webinars and other opportunities, learn about the health movement that's happening around the U.S. If you sign up for our newsletter, we will not inundate your mailbox, but it's a great way to stay connected and learn about upcoming opportunities.